Good afternoon. Thank you for attending the last webinar training for training part 1 for 2017. Webinar training part 2 will be available next month. If you have not already signed up for that, please do. Today we will learn to manage your account, manage your patients, add, edit, and remove immunizations, generate basic reports, generate a reminder recall report, and add ImmuNet users. ImmuNet is a secure online database that holds vaccine histories for children and adults throughout Maryland. ImmuNet data is confidential and fully HIPAA compliant. As you will see today, it's also very easy to use. And in fact, in most cases, ImmuNet can automatically get vaccine data from the electronic health records that your office is already using. In 2017, VFC providers will be required to report VFC vaccines administered to their patients. They will also be required to order their vaccines, including specialty and flu vaccines, through ImmuNet. Ordering and inventory management training will be offered starting next month. Again, all enrolled VFC providers for 2017 must report vaccines administered to their VFC patients to ImmuNet. That will be new vaccines that they administer in 2017, not their previous vaccines in any other year. Setting up electronic data exchange between your EMR or EHR and ImmuNet will allow you to meet your VFC reporting requirement without any interruption in your workflow. Participating in the Meaningful Use program is one way to meet this requirement, and it'll also allow you to get valuable incentive payments, tens of thousands of dollars over the course of the years that you participate. If you are already using ImmuNet and reporting data to ImmuNet, congratulations, you meet this requirement. All you'll need to do is prepare for online vaccine ordering in 2017. Briefly about that online ordering, you will be able to order your vaccines through ImmuNet in 2017. This will be easier and much faster, we think, than faxing the inventory form as you do right now. For the first time in Maryland VFC history, you'll also be able to check the status of your vaccine order and track the package right through ImmuNet. Next year, ImmuNet will also have an enhanced user experience with simplified menus and workflow. Today, you're going to see some of what that will look like. If you'd like additional training that covers these same topics but uses ImmuNet's current layout, please view the training videos available at mdimmunet.org. Click on HT3, Hot Topic 3, near the top center of the page. Those training videos cover these same topics, but they do so using the current layout for ImmuNet. As a reminder, we will be taking questions only at the end of today's webinar. This is the new ImmuNet homepage. The username and password login box will be in the middle of the page instead of in the left-hand side. To log into ImmuNet, enter your username and password, and then click Login. If you don't know your password anymore, or your password isn't working, click on Forgot Password. If you don't log in, generally at least once a month, you may be inactivated because of your lack of activity on the site. To ensure that that doesn't happen, please log in at least once a month to ImmuNet. Once you've logged in, you'll come to the new front page. With the front page buttons, you can easily search for patients, manage your VFC profile, or send a VFC inventory report. That's these big blue buttons that we have right in the front on the top. The sidebar menu will also expand now. As you can see in the example on this page, clicking on Patients expands that list to two options, 3 in this case. Merge patients won't be visible to you. When you hover over each, they will become blue and highlighted. Click on the one that you want to do. For now, let's pretend that you clicked on Find Patient. Find Patient brings you to the patient search screen. Search for patients using first and last name and/or date of birth. If you need to use other search criteria, you can press Advanced Search for additional options. However, those will be rarely used. Most of the time, last name, first name, and date of birth are all that you'll need. Additionally, ImmuNet considers everything after what you've written to be a sort of wild card. So you can write in Smith, and it will also give you, in addition to Smith, Smithson, or Smith-Jones. After you've put in your search criteria and press search, you'll be shown the results of that search. In this case, you can see we searched for the last name Test and the first name of client. We didn't use a date of birth. It brought up every patient that meets the requirement of Test as the last name and the first name of client with any date of birth. As I mentioned before, anything after the search criteria could have also been included. So if there was a first name client, last name tester, that would have shown up as well. Use the radio button in the middle of the page to select the viewing option that you'd like to do. For example, you can look at the demographics for the patient or their immunization history, or jump right to patient reports. When you've selected the client that you're interested in from the list of results, click on the last name, which is a blue link. If there is only one patient that matches your result, you'll be directed right to their screen. If your search did not come up with a positive identification of a patient already in ImmuNet, select Enter Patient from the expanded list in the sidebar rather than Find Patient. That will bring you to the Enter Patient information screen. Fields in bolded blue letters on this page are required. That's last name, first name, birth date, mother's maiden last and first name, and gender. Below the end of this screenshot, on the actual page, are additional sections for responsible persons, comments, and notes. When you've finished adding the required information and any additional information, click Save. The vaccine history page is very easy to read. It shows all the vaccinations recorded in ImmuNet. It is arranged in alphabetical order by vaccine group. Vaccines administered in each vaccine group are administered by the date, or are organized then by the date that they were administered. For example, you can see that DTaP had an administered dose on 3/7 of 2001 and 5/17 of 2001. The next column is the series. Again, looking at DTaP, you can see that 1 of 5 and 2 of 5 of the recommended doses were administered. Had one of those doses not been valid because it failed to meet the correct interval or had some other conflict, it would say not valid or be blank in the series column. The columns after that for trade name, dose, and reaction may be filled if that information was added to ImmuNet. If ImmuNet does not believe that your vaccine administered is valid, and therefore in the series column shows a blank where it says not valid, you can click on the date administered. A pop-up will show why ImmuNet does not believe that that is valid. Below the history is ImmuNet's clinical decision support. At the bottom of the history page, you'll see this. Completed series are shown along with earliest, recommended, and overdue dates. As you can see in this example, DTaP, Hep A, Hep B, pertussis, polio, and varicella are all complete. HPV has recommended and overdue dates coming up very soon. As shown with the blue highlights, influenza and MMR are both well overdue. ImmuNet's clinical decision support is only as good as the information that your office has put into ImmuNet. Although VFC only requires that you add new vaccines beginning in 2017, unless the patient's full vaccine history is put into ImmuNet, the clinical decision support will not be able to offer accurate advice. Now we'll talk about adding a vaccination. If you're using electronic data exchange, you probably won't ever have to add vaccines manually. However, if you do have an EHR but you're not doing data exchange, or if you don't have an EHR in your office, you will have to do these steps. To add an immunization, click Add Immunization above the patient's history. Select the vaccine group or groups that you want to add, and then click OK. There are 3 different columns for each vaccine group that describe where that vaccine is coming from. You should only ever use one of them per row. The From ImmuNet Inventory column is for vaccines that are in your ImmuNet Inventory module. That would include your VFC vaccines. Those are sent automatically into the ImmuNet Inventory module when a vaccine is shipped from McKesson. The From Other Inventory column is for vaccines that are not tracked by ImmuNet's Inventory module. This would include your private vaccines, unless you include those private vaccines into the Inventory module yourself. The Historical column is for vaccines that your office did not administer. Unlike the check boxes of the other 2 columns, the Historical column has text boxes. In that text box, you'll put the number of vaccines for each row that you'd like to administer. For example, if you have a new patient whose record shows that they already had 5 DTaPs, you could put a 5 in the DTaP row in the Historical column. The next page would then give you 5 rows of DTaP in which you could add any information that you have, like the date or the trade name if you know that. You can select multiple rows, but again, you should only ever use 1 column per row. When you've selected the vaccine group or groups that you would like to add, press OK. From there, you'll provide more information. If you don't provide a date on the previous screen, on this screen, the date will automatically show with the current date. For example, I made this screenshot on the 18th of October, and ImmuNet automatically filled that in. You'll also need to select the trade name. If you're doing this with immunizations from your ImmuNet inventory, like your VFC vaccines, the lot number will appear next to each trade name available. Select the correct trade name and lot. You may also do the administered by, dose, body site, and route sections. You must, in addition to trade name and lot, add a VFC eligibility. When you've done that, click Save. For vaccines that are from other inventory, there will be an additional field for you to put in the lot number. Tdap is a special case. Tdap does not have its own vaccine group like DTaP does. To add a Tdap vaccination, select TD. On the next screen, choose Add a Cell or Boostrix. ImmuNet will add a line item for TD and a line item for pertussis. To edit or delete a vaccination that you administered in your office or is historical, click on the pencil and paper button in the Edit column for the line item that you want to change. As you can see in this example, none of these vaccines are historical. If they were, there would be a yes in the historical column. Two of these vaccines, the pertussis and the TD, are not owned by the office viewing this record. Those line items cannot be edited. However, the other three can. When you click on the pencil and paper icon in the edit column for the vaccine that you are able to edit, it will bring you to the Edit Immunization screen. Here you can add or change information. Please note that not every field can be changed. For example, trade name. If you need to change the trade name, you'll want to delete the vaccine and re-add it. When you're done, click Save. This will direct you back to the vaccine history page. To generate basic reports for the patient, click the Reports button above the patient's history, or go directly to the patient's reports from the search screen, as we saw earlier. ImmuNet can create and fill out with all the information included in ImmuNet the vaccine administration form, the DHMH 4500, a Maryland 896 school certificate, the immunization history report, which displays demographics as well as complete immunization data, including uncommon vaccines like travel vaccines, and the immunizations needed form, which shows the same information as the immunization history report, but also includes the immunizations needed according to ImmuNet's clinical decision support. Please note that these forms can only show information which is included in ImmuNet. So if you do not add the patient's vaccines administered previously, they will not show up on these reports. However, remember that VFC is only requiring you to add vaccines starting in 2017. The Reminder Recall Report is another helpful report that can show you patients associated with your office who are due for a vaccine. To generate this, click on Reminder Recall. You can select to run a report with multiple criteria. For example, you can select to use all vaccine groups or just some specific ones, like HPV. Or you could do all vaccines required for schools. You can also select a target date range, for example, today's date to a month from now, everybody who will be due for a vaccine or overdue for a vaccine, or choose a birth date range, targeting only patients at a certain age. When you've selected your criteria, click Generate. That'll take you to this status screen. When you first get here, the status will read 0%. Click Refresh until the status is 100%, and the far left column under Started becomes a clickable blue link. That's circled in yellow. Click on that link to move to the next page. The next page will show you the number of patients which meet the criteria that you chose. In this example, it went from the 3,200 patients associated with Maryland DHMH down to the less than 500 who were ever immunized by Maryland DHMH. It then cut it down to only those that allow reminder recall contact. I did not specify a county, school, provider, or birth date range. It then cut it down to only those patients with a valid address. Patients must have a valid address to be counted in the reminder recall report, although address is not a required field in their demographics section. However, if you would like to make use of this report, please be sure to add a complete address to each patient's demographics screen. Finally, it cut it down to the 301 who were overdue or recommended for vaccines as of the day that I did this, 9/22/16. Below that are the various outputs that Reminder Recall can generate for you. It can generate a reminder letter, mailing labels, or just a list of the total patients eligible for the report that you ran. Click on the blue link for each output to generate that output. From any page, to access your account, click on My Account. This is shown in the top screenshot and circled in red. On the account page, you can edit your user account, the section circled in red on the bottom screenshot. If you are an administrative user, you will have additional options like adding user or editing users, circled in yellow. Administrative users can add new users. To do so, click Manage Access/Account on the current page. I'm showing that now because some administrative users doing this training may wish to add additional users now. However, in the future, that link again will be in the top right corner and will say My Account. It takes you to the same place. Once there, click Add User. Add the requested information in each field, and then click Save. The username must be unique in ImmuNet. The email address must also be unique in ImmuNet. If your users, the people in your office, do not all have unique work email addresses, they may use their personal email address instead. The password should include at least one capital letter, at least one lowercase letter, and at least one number. Once you've added that, and click Save, assuming the email address and the username were unique, the Modify Access tab will appear. You must click on Modify Access to continue the adding process. If you do not do it, the user will not have access. Click on Modify Access. You won't need to worry about the application or organization type fields. However, you may need to use the organization and role fields. If you are the administrative user for only one site, the organization field will show that site. However, if you are an administrative user for more than one site, select the appropriate site from the organization dropdown. Then select the role appropriate for this user. An admin user is someone who will be assisting with adding new users and can also order vaccines from VFC. A VFC user is someone who will be ordering VFC vaccine but doesn't need the additional options provided to an administrative user. Standard user is a good role for everybody else. Once you've added the organization and role, click Add and then Save. If your office is not enrolled or registered with ImmuNet, please do so as soon as possible. Go to the ImmuNet website, tinyurl.com/mdimmunet. Scroll down to start using ImmuNet today. Complete the online enrollment form. It is linked to the word Here, the last word of the first paragraph. Once we receive your form, we will email your ImmuNet username and password, along with other helpful information. If you don't have electronic health records, you will be, in 2017, reporting your vaccination data by the manual data entry method that we just showed. You may also be able to send a flat file. Contact the ImmuNet Help Desk for guidance. For those of you with EHRs, your vendor can help you set up automatic reporting from your EHR. Remember that federal funding may be available. Also remember that because it's automatic, that means that there will be no interruption in your normal workflow.